Asthma is a condition in which your airways narrow and swell and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing and shortness of breath. For some people, asthma is a minor nuisance. For others, it can be a major problem that interferes with daily activities and may lead to a life-threatening asthma attack. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and adjust treatment as needed. Symptoms: asthma symptoms vary from person to person. You may have infrequent asthma attacks, have symptoms only at certain times, such as when exercising, or have symptoms all the time. Asthma signs and symptoms include shortness of breath, chest tightness or pain, trouble sleeping caused by shortness of breath, coughing or wheezing, a whistling or wheezing sound when exhaling. Wheezing is a common sign of asthma in children. Coughing or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. Signs that your asthma is probably worsening include asthma signs and symptoms that are more frequent and bothersome: increasing difficulty breathing, measurable with a peak flow meter, a device used to check how well your lungs are working, the need to use a quick relief inhaler more often for some people. Asthma signs and symptoms flare up in certain situations. Exercise-induced asthma, which may be worse when the air is cold and dry. Occupational asthma, triggered by workplace irritants such as chemical fumes, gases or dust. Allergy-induced asthma, triggered by airborne substances, such as pollen, mold spores, cockroach waste or particles of skin and dried saliva shed by pets. Pet dander. When to see a doctor, seek emergency treatment. Severe asthma attacks can be life-threatening. Work with your doctor to determine what to do when your signs and symptoms worsen, and when you need emergency treatment. Signs of an asthma emergency include rapid worsening of shortness of breath or wheezing, no improvement even after using a quick relief inhaler, such as albuterol. Shortness of breath when you are doing minimal physical activity. Contact your doctor. See your doctor if you think you have asthma. If you have frequent coughing or wheezing that lasts more than a few days, or any other signs or symptoms of asthma, see your doctor. Treating asthma early may prevent long-term lung damage and help keep the condition from worsening over time. To monitor your asthma after diagnosis. If you know you have asthma, work with your doctor to keep it under control. Good long-term control helps you feel better from day to day and can prevent a life-threatening asthma attack. If your asthma symptoms get worse, contact your doctor right away if your medication doesn't seem to ease your symptoms, or if you need to use your quick relief inhaler more often. Don't try to solve the problem by taking more medication without consulting your doctor. Overusing asthma medication can cause side effects and may make your asthma worse. To review your treatment. Asthma often changes over time. Meet with your doctor regularly to discuss your symptoms and make any needed treatment adjustments. Causes: it isn't clear why some people get asthma and others don't, but it's probably due to a combination of environmental and genetic, inherited factors. Asthma triggers exposure to various irritants and substances that trigger allergies. Allergens can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne substances, such as pollen, dust mites, mold spores, pet dander or particles of cockroach waste. Respiratory infections, such as the common cold. Physical activity, exercise-induced asthma, cold air pollutants and irritants, such as smoke. Certain medications, including beta blockers, aspirin, ibuprofen, Advil, Motrin IB, others, and naproxen, Aleve. Strong emotions and stress. Sulfites and preservatives added to some types of foods and beverages, including shrimp, dried fruit, processed potatoes, beer and wine. Gastroesophageal reflux disease (GERD), a condition in which stomach acids back up into your throat.